Hi, I'm Dr. Ronald Krueger, and I'm honored to give the 2020 Jose Rizal International Medal Lecture From Smile to Like. I'm currently a professor and chair of the Department of Ophthalmology at the Truhlsen Eye Institute of the University of Nebraska Medical Center, and I have no financial interest in this technology. Jose Rizal was a Filipino nationalist that lived in the 1800s during the Spanish colonial period, and he was an ophthalmologist by profession that became a writer advocating for political reform. He was ultimately executed for his views after the Philippine Revolution, but his actions led to Philippine independence, and he was considered a national hero in the Philippines. The Jose Rizal International Medal recognizes outstanding personalities outside the Asia-Pacific region who contributed valuable developments in ophthalmology to Asia-Pacific region. There is a distinguished list of participants and awardees over the last 40 years, and I'm pleased to be added to this list in 2020, giving my lecture From Smile to Like. What is SMILE? SMILE stands for Small Incision Lenticular Extraction, and it's a form of refractive surgery that's performed with a laser where internal tissue is removed from the cornea to correct myopia. The femtosecond laser was introduced about 20 years ago and has been instrumental in changing the way that refractive surgery is done. But amongst those changes is the creation of SMILE and its global popularity over the past decade. At present, there's over 3 million SMILE procedures performed worldwide since 2009, and even in the last 4 years, US FDA approval with commercial release has been in the United States. Your smile would be worth a whole lot more if you could share it with others. And this lecture is all about the concept of smile for one particular individual who can then benefit others to create like. So what should we do with all these extracted lenticules? Should we discard them? Rather, we should implant them for keratoplasty from smile surgery. The very first reimplantation of a smile lenticule was recorded in 2013 in Nepal from an allogeneic lenticule that was taken from one patient and placed into a hyperopic eye of another. In 2015, there was a series of patients who had myopia in one eye, hyperopia in the other, and one eye was providing tissue that could be implanted into the other in an allogenic fashion. Both of these articles were from the Asia-Pacific region. So what are some of the things to consider with like surgery? I've come up with this list of 7 different items that we'll go over, that of refractive and treatment indications, implantation techniques, tissue preservation and that of eye banking, immunogenicity and cell sterilization, shaping and refractive predictability, risks and benefits over other methods, and then finally, cost and business feasibility of this model. In the first one, refractive and treatment indications, the most obvious indication is that of moderate to high hyperopia. After all, the lenticules that are removed have more power centrally as they're correcting myopia, and that power can be used to help a hyperope. Barraquer's law says that if tissue subtraction from the center of the cornea corrects myopia, then an equal amount of tissue addition in the center of the cornea should correct hyperopia. This law was created by Barraquer over 70 years ago, and we're now seeing a realization of this concept with modern day technology. The next indication would be that of presbyopia, where a small lenticule of only 1 to 2 millimeters could be created and placed under a flap or in a pocket in the center of the cornea to steepen the center and extend the depth of focus for better reading vision. And then the final indication would be that of keratoconus, where an unstable cornea that's particularly thin could be thickened with tissue addition, and the shape could help to minimize the the refractive error, and the irregularity of keratoconus. Also, the tissue placed into a pocket could stretch the tissue with arc shortening effect to help flatten the cornea further. Number 2 in our list is that of implantation techniques. Now, this can either be done under a smile pocket, as seen to the right, or under a LASIK flap, as seen in the video to the left. The nice thing about the flap is the flap can be lifted 4 to 6 weeks later, and an excimer laser reshaping of the lenticule could be done in order to correct the refractive error further. Lenticular implantation keratoplasty itself was coined to popularize this concept of a graft being placed under a flap. And as you see below, even an eye with hyperopia and astigmatism can have a spherical lenticule placed, and then later the flap can be lifted and an astigmatic correction performed in order to finally neutralize the refractive error. Number 3 in our list is that of tissue preservation and banking. Optical or transplant media such as Optazol and other media can be used, or cryopreservation. And there's issues whether one should personally store or community store this tissue. The first article of cryopreservation of small incision lenticules was by Sri Ganesh in 2014. And this was also in the Asia-Pacific community. In that article, he showed that cryopreservation with liquid nitrogen could store lenticules for greater than 4 months period of time when preserved in 10% phosphate buffer. Since that time, a number of other articles have been published, again in the Asia-Pacific region, by Dr. Mehta and colleagues, showing a number of different tissue media for short-term and then ultimately longer-term storage from days to that of weeks. And then that's been further validated with experimental study together validated with the Singapore Ministry of Health, showing the feasibility of lenticular banking in this capacity. This really leads to a whole new concept of refractive eye banking, where smile lenticules can be used to treat hyperopia, presbyopia, keratoconus. Eye banks could provide fresh corneas for fashioning for like procedures for hyperopia and for keratoconus, and together with desect lenticules. And they can also provide tissue that can be lyophilized and packaged by commercial entities and then sold for off-the-shelf use. Number 4 on our list is that of immunogenicity and cell sterilization. And there are some various ionizing and enzymatic methods for which to neutralize the cells in the cornea. Sodium dodecyl sulfate, SDS, is one of the more popular ones, but recently anhydrous glycerol together with cryopreservation has become another popular method. E-beam radiation has also been considered. Here in an article that nicely shows autogenic, allogenic, and xenogenic grafting of tissue, both the autogenic and decellularized allogenic grafts have no inflammatory reaction because of the lack of cells and cell genetic signature. However, in xenographic or allogenic grafts without decellularization, infiltrates can often be seen at the interface. Decellularization has been looked with a number of different components, some ionic, some enzymatic, but the one that seems most popular is the SDS because it also tends to preserve the overall tissue architecture, whereas some of the nucleases can distort the actual collagen fibers. This leads us to an article that was published in China, which shows very nicely that the genetic signature with HLA factors can be eliminated with both SDS and the anhydrous glycerol with cryopreservation. And the anhydrous glycerol seems to also have even better tissue preservation of the collagen fibers. When looking at tissue clarity overall, you can see increased clarity with the anhydrous glycerol, very much in comparison to fresh tissue when comparing that to the SDS, which also has fairly good clarity. Number 5 on our list is that of shaping and refractive predictability by looking at mechanical shaping methods with microkeratomes and trephination, femtosecond laser of the donor tissue as well as the host in creating the pocket, excimer laser reshaping, and also just looking at predictability, stability, and regeneration capabilities. Individual blanks can be used and shaped with an excimer laser for donor corneas can be mechanically reshaped with a pre-formed lenticular cavity unit that comes up with the exact shape of the lenticule that would be necessary, and that can be placed under a LASIK flap. Also, trephination of smile lenticules can be used for correcting keratoconus, or also for making very small individual lenticules for presbyopia correction. Relimp was refractive lenticular implantation, was popularized here in a case of aphakia with a very large correction. Here you can see more than 10 diopters of refractive error, could have a very high power lenticle implanted that's spherical, and then a smile pocket could be created with some cylinder correction to overall make a uniform outcome here seen to the left, and a difference map showing over 16 diopters of overall correction. The stability of this treatment is superb at 6 months and 1 year after the surgery with no regression of effect. A whole series of high hyperopes have been looked at to show also good predictability and stability of refractive effect from 3 to 10 diopters of hyperopia, and in many cases the post-op uncorrected visual acuity is equal or better than the pre-op best corrected visual acuity, showing real promise in overall correction. Lenticular implantation can also be done for keratoconus in a pocket, and this particular study, whose senior author is also from Asia Pacific region, is a meta-analysis of 10 studies that showed that a lenticular implantation in keratoconus appeared to expand the stromal volume in thin corneas, which flattened the cones and significantly improved the uncorrected and best corrected vision. Lenticules used for keratoconus have been concave meniscus shaped, where the periphery is thicker and the center is thinner, which has been effective for central cones, also in donut-shaped lenticules, which are good for central cones. But planar lenticules can be actually beneficial in even asymmetric cones with inferior steepening lenticule pattern. This article out of Iran actually shows how a smile lenticule can be decentered in terms of trephination to cause a thicker portion inferiorly, and in asymmetric cones, this kind of necklace formed lenticule can be implanted to show some pretty good overall stability. And here you can see overall shape changes that help to minimize the steepness inferiorly for better overall symmetry. SLAC is standing for stromal lenticular addition keratoplasty, was popularized for this keratoconus using meniscus-shaped lenticules. And you can see very nicely how a central cone over to the left can then, 6 months after implantation, be a much broader overall uniform pattern centrally. And with that, the epithelial thinning that you often see at the apex of the cone actually becomes thicker and helps to regularize the overall shape centrally. You can see overall the overall shape on an OCT showing greater regularity of the cornea. Also, which has been investigated further, is the idea of mesenchymal stem cells being implanted with decellularized corneas. So not only are you decellularizing, you're recellularizing them, which is helpful in creating some new collagen in an otherwise thinned cornea from keratoconus, and also by recellularizing with adipose-derived adult stem cells from an individual, it's possible to make an allogenic donor lenticule into an autogenic graft by having one person's own cell signature. Number 6 on our list is that of risk and benefits over other methods. Moderate to high hyperopia is an obvious procedure, and it does have benefits in creating a more prolate shape compared to LASIK. Less dry eyes, less regression over effect, it's removable, and there's a much higher range of overall correction. Presbyopia with small inlays is preferable over synthetic inlays and removable and adjustable. And with keratoconus, no rejection, less dry eyes, quicker healing, no sutures, and greater stability makes this preferable over PK or even dull. Finally, that of cost and business feasibility, thinking of things such as banking of SMILE lenticules as a business, the need for reasonable processing costs, the question of regulation of commercial lenticule shaping, surgeon shaping with an excimer laser or femtosecond laser, insurance coverage of costs that might be seen in anterior keratoplasty, and then even self-pay elective costs for more refractive. The advantages and challenges to consider are that eye banks are a model of safety and efficacy in the world. The US FDA gives special classification to eye banks in tissue preparation so that shaped lenticules should be provided by the eye bank similar to DSECT. Bank SMILE lenticules in biorepository can be more cost effective than reshaping fresh tissue from donor eyes, and this would be important, especially with more elective refractive procedures, which would need to be cheaper to make it cost effective. The challenge would be with SMILE lenticules is that you need to get serology on all donated SMILE lenticules, which would be more challenging, and that would also be important in keeping the cost low. Eye banking could become a profit center beyond the pass-through that's provided for covered services by offering these elective tissue lenticules. Recently, Ocular Surgery News published this article of reuse of SMILE lenticules presenting opportunities and obstacles. I was one of the co-authors in this article, and it nicely showed the new frontier in which refractive and corneal surgery could interact. It also demonstrated that eye banks could ensure quality and safety of the tissue and help to facilitate the development of a regulatory framework that could reuse lenticules from living donor eyes. The issue really will be all about cost effectiveness. Allotex is a commercial entity that is looking at using human corneal tissue that can be lyophilized and then stored with a shelf life of 2 years. This can then be reshaped later by surgeons with a industrial femtosecond laser or excimer laser, and then implanted with good centration. The Allotex blanks can be modified by an individual surgeon for good precision, which makes it easier on a regulatory basis. And then finally, in addition to excimer lasers, the use of femtosecond lasers can be used to reshape both cornea and individual lenticules using modern-day technology into whatever shape would be necessary for the refractive correction. So in conclusion, SMILE is growing rapidly with more than 3 million cases worldwide. SMILE lenticule implantation, is a new frontier in refractive surgery for high hyperopia, presbyopia, and keratoconus. Reusing SMILE lenticules or reshaping donor corneas is safe and effective with modern technology and eye bank processing. And refractive eye banking is a potential new market and new partnership for bringing this technology to our field and building on the legacy of Jose Barraquer from over 70 years ago, who proposed these ideas with the modern age of femtosecond lasers. Thank you for your attention, and thank you for the honor of this Jose Rizal International Medal.